want to tell you something. When I got here, it was dark, and right now it's dark. So that means we're really working a lot here in, where are we, in New York. And I'm super excited to be here because one of my beautiful patients, just getting her ready for the holidays, just overall things that we do yearly for women. The area around the mouth. This is a key area. I always tell people a few things. If you have scarring or if you have like wrinkles that start to form, they become more prominent around the mouth. It makes you look like you have lip lines. It makes you look like you're frowning a little bit. So a little filler, when placed properly to the corners of the mouth, the chin area, and what I call the lower cutaneous lip, which is this area right through here, gives a lot of support. I know everyone's gonna say she has beautiful lips, which she does, great shape, but they tend to, because I do them exactly, and you were born with them. So just that little enhancement makes it a little bit better. We're gonna add a little bit of filler there. I like Volbella to the lip, especially in patients like her that have that nice already Cupid's bow that's shaped and don't want a huge amount of volume. Remember, my patients like to look natural, like nothing's done, so we're gonna make it look just subtle, a little more plump. I call this type of injection the internal chapstick because the filler holds water and it makes it a little more like plump, a little hydrated, but not super voluptuous. It just looks good. So all right, let's just soften around the mouth.
Someone's saying, Nick Miller's saying cherry wine.
Oh my gosh.
Is he gonna have some tonight?
Nick, we better get some later.
Sakura's saying she's beautiful. We got,
She
hey,
is.
Dr. Emer. Hello, handsome.
Hi guys. Now, you know, I'm really lucky because I have really great patients who travel many hours to come see me, which is her. And we have just a long-term relationship. So I know their face. We've done lasers together for her acne scars, which honestly, I think if people looked at her,
You couldn't tell they were even there.
Had any, which is really good. Which is, I mean, a huge thing, you know, for our acne scar clients who are very depressed because they have, you know, scarring. This little bit of filler helps honestly just build a little bit onto the chin area and support the marionette, which is basically the corner of the mouth. So I'm going to do a little on the deep part of the chin.
Someone's saying kissers from Equinox.
What?
Someone's at Equinox sending kisses.
Oh, awesome. Well, I'm planning to go to Equinox tomorrow morning, you guys. So I don't know which Equinox they're sending kisses from. But I was planning to go to Columbus Circle. Alright, so I'm doing just a little bit of support to her chin. Just to give that little support.
Hello, doctor. Would you please let me know what treatment you offer for hyperpigmentation after peeling?
Oh my god, you guys have to call us because that's one of the things we specialize in. We just had a patient actually in the other room who I didn't do a video of. I'm gonna come around. Joshua for a second. Sorry, you guys. New York rooms have a little space. We work it out. So again, what I'm doing is I'm just kind of blending the marionette with a fine HA filler. This goes a little more superficial. And this will improve like just textural issues. You see she has like these little textural issues around the mouth, but also the fact that it just helps the corner of the lip, lifts it up. This is our female enhancement, just that little boost. Nothing crazy. And I did do a little injection into some scars. Do you treat
gummy smiles?
Yeah, I do. It just depends on what the person wants. Because remember, when you treat a gummy smile, you guys, you're not going to be able to lift your lip up as much when you smile if you're doing Botox there. So just changes the way your smile is. Okay, so now that lower part's done. That's the marionette and the corners of the mouth. I'm going to go back around. Perfect. Good. I'll scoop by you. And we're going to do the fun part. The biggest transformation, the lip. I know, it's not fun for you, but it's fun for me because it's the artistry part, but not the pain. Okay, so we're gonna do a little lip, and her lips look great, but I wanna make sure I have at least an equal balance on the top and the bottom. So we're gonna do just...
What filler is he using again? Right now you're using Volbella, right?
Yep, this is Volbella. I love it because it lasts about a year for most girls. And it just looks really natural. And you can still get a little shape, but it doesn't look like it's been done. So we're gonna give her a little volume and a little hydration. Sorry, honey. Using a pillar technique because she has really nice pillows already. Smile. Perfect. Good. So that looks really good. Now what we want to do is just keep her Cupid's bow. Keep that nice shaping because she has that really good aversion. Look at that, just that little bit. And then she has this really nice column. So I'm just gonna keep that. Sorry, honey. Breathe out, breathe out, breathe out. Good. Perfect. So you see how I just defined that little column right there? And then lastly, the pink part. That's it. Last one on this side. Done. Okay, so now I'm gonna switch. You can show the one side versus the other.
It's really not that bad. I'm just a baby.
I am too, though. Come, we're doing some lips live.
Hi.
Hi, guys.
So look,
that
let me
looks
show you.
Someone's saying her lips are gonna be more kissable.
Oh, I don't know if she's allowed to be more kissable, but so look, we already defined a little bit on the Cupid's bow. So with her, you guys, I'm not even really doing anything super special. I just want to get that little bit lifted. Sorry, honey, that one hurts a little. Good. And just right on the edge. Okay, I know. One more. Good. Okay, hold on. Close your eyes. I'll get any tears. And then lastly, I'm just gonna do one little pinch. Good. All right, let me see from the front. Hold on. Last part, you're just gonna do glue on this pillar. Okay. Great. All right, you guys. So look up close. Let's show her, because I know she already knows she's gonna like it because she comes to me on the farm. Where is the?
It does last a year because I came.
I can pass her the phone. Let's do
A
Emma
year
a
reveal.
year ago. Yeah.
Let's do an Emma reveal. Let's pass
Do an
the
Emma
phone.
reveal.
All right, here, let's
Yeah,
pass
show
the
her.
phone. All right, we're gonna give her the phone right now. Hold it like you're taking a selfie. Hold it up. Hold it.
Oh, sorry.
Oh, here. Yeah, so see
There you
what
go.
think.
They look great.
So here's what I did, because I want you to see a little bit. So a little more definition. She already has a really nice Cupid's bow, and then just a teeny bit to pillars, because your pillars, it always looks really good on your face, especially being so structured. And then look at the little scarring, which really wasn't that much. Corners of the mouth lifted, so you can see the corners are now lifted and kind of curved upward, and then a little more volume in the middle.
I love
Beautiful.
it. Thank you so
Perfect.
much.
Now look in the mirror, because I
take
feel
my
like it
phone.
looks different. I don't know. I feel like it just looks better in the regular mirror.
Oh, yeah.
Doesn't it? That's the thing. Everyone always looks at their face on the phone, which I think distorts it a little bit.
Just like a little younger. I love it.
That's perfect. We're similar age, although you wouldn't know that. She looks so good. All right, you guys. Female facial sculpting in Manhattan. Super happy to have my amazing patients. Bye, guys. And let me see. Yeah, it's perfect. It's great.